Welcome to Health Break by UPMC Health Plan, your quick guide to health, wellness, and how to make the most of your health insurance plan. I'm your host, Dr. Camille Clark-Smith. I help to oversee the quality of the plans and programs we offer at UPMC Health Plan.
And I'm your co-host, Angelo Bartik. I'm a health coach who works with our members on making healthy lifestyle habits and setting goals. This is your Health Break.
Hey everyone! In today's episode, we're discovering why it's important to have an action plan if you have a medical condition. And here with us to discuss it is Dr. Anthony DeFail. Dr. Tony, thank you so much for joining us today.
Thank you for having me here today.
So my first question for you today is, what is an action plan?
So an action plan is a checklist of things for you or your loved ones to do if you have a flare of your chronic condition or an acute medical condition that needs addressed.
How do you create this action plan?
First of all, you need to get a copy of your medical history. Your medical history is a list of your current medications, allergies, current and past medical conditions and surgeries, providers and their phone numbers, and an emergency contact list of your family. If you don't have a medical history, it's very important that you talk with your healthcare provider and walk through the steps involved in creating one. Once you have one, it's very important to also have a copy whenever you need it. In fact, my parents have a copy in their car, in their luggage, and in my mom's purse, and they've used it multiple times. Again, it's very important to have multiple copies because if they're needed, the healthcare providers will likely take them from you. Just having a medical history will help out a ton if you're in an acute situation. It allows the providers to understand what's gone on in your past and what you need specifically based on your medical conditions. Besides having a medical history, knowing what to do if you have an acute flare of your chronic condition or an acute medical condition is very important and can save time and potentially your life.
Wow, sounds important to create an action plan. How can an action plan be helpful for people with existing medical conditions?
What an action plan can do is give you those next steps. When you're having a flare of a condition and you're feeling ill, it's really scary and it's tough to figure out what to do. So getting this action plan in place ahead of time can really help you out and give you that extra sense of calm when things are going wrong. Creating this action plan can be as simple as knowing what to do if you run out of your medications or lose them. It may be as complicated as knowing to take an extra dose of a medication or a rescue medication when you have a flare of one of your chronic conditions. Again, this is why it is very important that you walk through the action plan with your healthcare provider and have it in place when things go wrong.
Those are all the questions I have for you, Dr. Tony. Thank you for taking a health break with us.
Thank you for having me. It was a pleasure.
Don't forget, create an action plan for your health to keep yourself and your loved ones informed and prepared. Find show notes and more information at upmchealthplan.com/podcast. Join us as we continue exploring health, wellness, and how to make the most of your health insurance plan in the next episode of Health Break. This podcast is for informational and educational purposes. It is not medical care or advice. Individuals in need of medical care should consult their personal care provider. Views and opinions expressed by the host and guests are solely their own and do not necessarily reflect those of UPMC Health Plan and its employees.